Hello and welcome back to the clinical cases for second years. Today we're going to be continuing with the foundation block. So this is part 2 of the video, and we're going to be exploring the remaining 6 cases that we were taught about in foundation block. So let's start with Marfan syndrome. So Marfan syndrome is a disorder of the body's connective tissue. So it's a hereditary condition, and it's caused by a gene defect, and it's in the abnormal production of the protein fibrillin. It's inherited in an autosomal dominant manner, so as we discussed in the previous video, autosomal dominant is the inheritance where there's a 50% chance that the child is going to be affected. It's a 50% chance they're going to inherit the gene, regardless of whether they're male or female. In terms of symptoms of Marfan syndrome, so you'd expect the patient to be tall with a slender build and disproportionately long arms, legs and fingers. This picture here sums up quite well the symptoms of Marfan syndrome because they're normally quite physical. Okay, and in terms of treatment and management, most people with Marfan syndrome have problems with the heart and blood vessels. Okay, so particularly a weak part of the aorta, leading to the possibility of an aortic tear or rupture. In terms of treatment, it's quite tricky, and you'd normally expect that the treatment would focus around helping to delay or prevent any complications that Marfan syndrome may cause. Moving on, so this slide looks at embryological malfunctions in general. So the main two that we were taught about in this particular lecture were Esophageal Atresia and Gastroschis. So Esophageal Atresia is a rare birth defect that affects the baby's esophagus. So my particular interest of this slide is this particular picture here. So this picture shows the different defects and the different ways structurally that this can go wrong. And you can actually see the clear differentiation between the trachea here at the front and the esophagus that should be running posteriorly. However, the issues that are arising there, you can see the ways that it's joining onto the trachea, which it really shouldn't. The upper part of the esophagus doesn't connect with the lower esophagus and the stomach. And it usually ends in a pouch, which means that food isn't being able to reach the stomach. So the main issue with this condition is that food is not getting to the stomach as it should do. And the best way to repair this is an operation. It's usually going to take place when the baby is very young, because it's a common thing seen in preterm babies. Gastroschis, this is a birth defect of the abdominal wall, where the abdominal contents are outside of the abdominal cavity. When the baby's born, the intestines are found outside of the abdominal cavity. So the common way to treat this is through surgery. However, the most effective way of doing this is through partial reinstatement of the intestines back into the abdominal cavity. So you can see this in the bottom picture here, how this is done in a stage-by-stage process in order to safely put them back into the body. Okay. Cystic fibrosis. Now this is a really interesting case, and actually we covered a lot of this in first year. So cystic fibrosis is an inherited condition. You should know it's inherited in an autosomal recessive manner. The thing that's characteristic about an autosomal recessive inheritance is that it skips a generation. And this, again, can be really clearly seen in the pedigree trees. So you tend to have a sufferer in one generation, skip a generation, and then again a sufferer. Okay? The symptoms associated with cystic fibrosis are recurrent chest infections, difficulty to put on weight, diarrhea, and occasional wheezing and shortness of breath. Now that's quite obvious really when you think about it. Wheezing, shortness of breath is a build-up of thick, sticky mucus in the lungs, so obviously it's going to cause breathing problems. It can also cause digestion problems as well. Okay. Over many years, the lungs can become increasingly damaged and in some cases may even stop working. So causes we've already discussed, it's really due to inheritance, it's due to that autosomal recessive inheritance. But how can we treat cystic fibrosis? So cystic fibrosis is normally treated with antibiotics. So these are to prevent or treat chest infections. So it's almost like management of the condition as opposed to treatment. Medicines to make the mucus thinner, so thinning the mucus, making it easier to cough up, and therefore less of an irritant in the lungs. And also medicine to widen the area, so bronchodilators. So really, if you think about this as a common link with asthma, buildup of mucus, constriction of the airways. There's really a few similarities there. Okay. And also a key treatment is to prevent malnutrition with a special diet if the patient is suffering from digestion problems, as we mentioned earlier, as a symptom. Moving on, we have Down syndrome. So Down syndrome is a really important genetic disorder that you need to be aware of. It usually shows some form of learning disability. However, this massively varies from individual to individual. The most common reason behind Down syndrome is trisomy 21. So this is where you get 3 copies of chromosome 21 instead of 2. So obviously we should have 46 chromosomes, 23 pairs, but in this case you end up with 47 altogether. And this actually accounts for Down syndrome in around 95% of all cases. Having said that, we shouldn't forget about the 2 other reasons that are behind Down syndrome. So for example, mosaicism. This occurs in around 1 to 2%, so this is the least common. But it can result actually in a milder level of intellectual deficit in Down syndrome. And lastly, translocation. So this is where part of chromosome 21 breaks off and then is attached. So translocated is a fancy word for attached onto another chromosome. This is commonly to chromosome 13, however it can be to other chromosomes. And it's really where just a small part of chromosome 21 breaks off and attaches elsewhere. What causes Down syndrome? It's obviously, we know physiologically it's caused by an extra chromosome. In most cases, this isn't inherited. It's simply the result of a one-off genetic change in the sperm or the egg. So there's a small chance of having a child with Down syndrome within any pregnancy. However, risk factor-wise, we have to be aware that with increased maternal age, we have an increased chance of having a child with Down syndrome. What does Down syndrome increase the risk of? Well, you should be thinking about heart disorders, you should be thinking about hearing and vision problems, thyroid problems, and any recurrent infections such as pneumonia. 2 cases left to go. So this one is ADHD, so Attention Deficit Hyperactivity Disorder, which is a group of behavioural symptoms that include inattentiveness, hyperactivity, and impulsiveness. So they're the 3 key symptoms of ADHD, which you would expect to see in a sufferer. The exact cause of ADHD is unknown. However, a list of potential causes have been prepared here. So most commonly being born prematurely. As we said earlier, full term is 37 weeks of pregnancy, so being born before that time. Having a low birth weight is also a high risk factor. And another important risk factor is during pregnancy if the mother smokes or abuses alcohol or drugs. It's thought actually that around 2 to 5% of school-aged children may have ADHD in our current society. And in terms of management, I like to use the word management here instead of treatment, because we try to manage ADHD in the respect that we try to give advice, we try to give support for parents, but also if you do want to look at the treatment aspect, there are medications that are prescribed to children with ADHD, so that's really important in terms of treating or helping them deal with that inattention, that hyperactivity and that impulsivity. And finally, we go on to look at autism. So autism spectrum disorder is actually a broad term that's given to a range of similar conditions, which includes Asperger's syndrome. And the main gist behind autism is that it affects an individual's social interaction, communication, interests, and behaviours. The particular focus here is social interaction, and that is really what it does affect. So people with autism tend to have problems with communication with others. And this sometimes can be told from an early age when children with autism don't babble or use other vocal sounds that you'd normally expect. So missing key milestones here is a significant indicator of autism. Statistically, more boys are actually diagnosed with a condition than girls, and children who have a sibling with autism are more likely to also be a sufferer. The exact cause of autism is unknown. However, what's a massive issue here is that many years ago there were concerns that the MMR vaccine was actually causing autism. Of course, now this has been disproven. However, for a short period of time, people refrained from getting the MMR vaccine because they thought it risked their child developing autism. However, I should point out that it's clear there's no evidence of a link between MMR and autism spectrum disorder. In terms of treatment, again, there's no cure to this illness. However, it is treatable, and getting a good treatment plan in place is what's often going to provide the best long-term improvement in quality of life for a sufferer. So having a predictable schedule and being able to build on your child's interests and teaching them new tasks in a series of simple steps. Really what this is really going towards is step number 6, so involving the parents. So obviously a good treatment plan will combine that work of the doctors and the nurses in hospital, but also those of the work that the parents do at home, because it's actually how far the parents push their children that can have a significant impact on the quality of life of a sufferer from autism. Okay, so that's all the cases of foundation block now done. So we've covered 16 cases. If I have missed any, please let me know. However, I've tried to cover all the main ones that were in the learning outcomes, and any extras that they did try to place a specific emphasis on. Also, if you do have any feedback, please feel free to let me know, or if these videos have been in any way, shape or form helpful to you in terms of preparing for hospital placement or your exams. Hopefully in future they will be more useful. Foundation block is a little bit of a tricky one to cover because it covers a bit of a wide range of illnesses. However, in future I hope these videos will be more specific to an actual subject, so cardiovascular and neurosensory, for example. Okay, thank you very much for listening.